Hey everyone, how's it going? Today we have Michael Loomis and myself, Ben Duenes. We're here at Personalized Nutrients, just recording some content, seeing what we're able to get today, talking about how we're really revolutionizing the industry. What we do is so different from what any other company out there is doing. So yeah, I guess we'll get started. Michael, what's your take on what we're doing here at Personalized Nutrients?
Yeah, yeah. I mean, when I came across what we were doing, I couldn't sleep just because kind of seeing the industry and where it was headed and just being around the industry for forever. My dad was a medical doctor for 40 years. My mom was in and out of the traditional healthcare setting, which did have a need at times, but also led to her being on medications, not getting better, not finding the root cause, getting worse with medicine. I just saw her jumping around a lot. And so, I think what we're really doing, and we've kind of coined the term revolutionizing the nutraceutical industry. And I think there's always a need for, when we're talking about personalized nutrients, there's always a need for condition specific blends, right? Hey, I want my own multivitamin, I want my own stress support. But when you start to see where things are going with all the testing, and especially with AI, some of the tests that are coming to us that we're seeing that's utilizing AI and research to get so hyper precise with the patient's needs based upon biochemistry and metabolic signature and even based on height and weight. It's just really hard to go get the patient exactly what they need by giving them a bunch of products off the shelf, right? They're probably ended up taking 10 bottles, 15 bottles, 20 bottles, and the dosing isn't exactly what they need, right? Either. So maybe you're getting some carryover, or it's maybe 100 milligrams more than they need. So to be able to be so hyper precise, and so just to give practitioners the ability to say, hey, instead of recommending 10 to 15 bottles, what if I can consolidate this all into one formula for my patient, one or two formulas for my patient, give the exact dosing that they need based upon what these labs are telling me. Like if they need 5,000 IU vitamin A, you can give 5,000. If they need 4,500, you can give that exact dose. And that's what I think really drives clinical outcomes, is meeting the patient where they're at with their biochemistry, giving them the exact data they need, but then also giving it in a way that allows them to be compliant. Because I think at the end of the day, you can debate when you should take things, when you should not take things, but ultimately taking them is most important, right? So if they're 95 compliant versus 80% compliant, they're gonna have better clinical outcomes and it's freshly made. So I think that's our goal. It's just to give and to be a part of this growth in the industry going towards personalization, especially with the technology coming out. I think it's just pretty remarkable to be able to have a solution to target the exact things that they need is pretty cool.
Yeah, no, 100% agree. And at the end of the day, I think you hit the nail on the head in terms of compliance, right? Like compliance is a big deal for a lot of practitioners and a lot of patients. It's like a doctor could sell somebody 20 bottles of supplements, but what's the likelihood that they're gonna crack open every bottle and take the exact amount of capsules that they're supposed to take from each bottle? And then you start to think about the fact that all these bottles are different supplies, right? It's like a lot of times they're 30-day supplies. Sometimes it's a 45-day supply. Sometimes it's 90. It's like, you're depending upon the patient to kind of stay on top of that. And it's not easy to comply. It's not easy to, go back and make sure that you have all of your supplements because they're all running out at different times. So yeah, personalized is a great way to enhance compliance. It's a great way for doctors and practitioners to track compliance too, right? Because if your patient orders 3 months and then they come back and they still have 2 months and it's already been 3 months, it's like, that they weren't compliant. Whereas if you have a patient coming back and they ran out of their supplements or they're just about to be done with supplements, yeah, it's a great way to see how compliant a patient was for sure. So yeah, I think that's all super important. I mean, I know, maybe we can't talk specifics, but I know, you particularly are talking to a lot of different companies and organizations that are interested in, integrating with us here at Personalized Nutrients to be able to offer their patients personalized formulas. Would you be able to speak to a little bit about kind of the demand behind that? And yeah, kind of, I know you've already hit a little bit on what's driving that, but yeah, kind of the demand that you're seeing there.
Yeah, I think especially in 2025, I think some shift has happened, and it's kind of hard to pinpoint exactly what it is, but I think a lot of it's just driven by the technology and especially AI. So we're just having a lot of organizations coming to us or practitioners where, yeah, like just to be able to offer truly personalized medicine with all the technology and AI to zero in on what they need, like they just need personalized solutions. It's just really hard to do, especially if you're saying you're doing personalized medicine and then to give them a bunch of different bottles that aren't really personalized to their needs when you're walking through these reports with them, it doesn't really fit. like across the board for offering a personalized solution. So yeah, I just think there's just a big trend in the industry going that way. I just don't think it's going to backpedal. Again, there's always a need for white labeled formulas, right? That address certain conditions, binders, things like that are always going to be needed. Yeah, like if you're looking at a patient's, like some of these platforms, they're looking at everything. They're doing a gut test, they're doing a metabolomics test, they're doing genetic functional genomic testing. They're looking at so many things, toxins, right? And so when you get all of that data, say, okay, here's 25 bottles, just doesn't make a lot of sense. And so, yeah, it's just pretty cool to see these companies coming to us and what they're doing, the platforms they're putting together to use AI to take all this data. Because I think the hardest part before now that sometimes has been hard for us to communicate is, okay, here's all this data. Now, how do I take this data and personalize it for a patient? Right? I think that's part of the issue sometimes with, doing all the testing is like, how do I take this data and actually know what to give and when to give it and what dose and all that? A lot of it's trial and error, a lot of it's intuition, just kind of seeing what works. But now with technology, we're able to have access to all research out there ever been done and be able to get so hyper personalized. So because of that, it just makes sense for them to be able to find a solution that's streamlined, doesn't cost a ton of money for the patient to buy separately, so they can take it to match their needs. So that's what I'm seeing. I don't know, Ben, if you're kind of what you're seeing on that front.
Yeah, yeah, no, I would agree with that assessment, and I think we meet over the years we've met with a lot of practitioners, right? What would you say the reasons maybe why practitioners either A don't get started or maybe B why they think they may not be equipped to do personalized supplements when they're already prescribing tons of nutritional supplements on a daily basis?
Yeah, I think the human brain one doesn't like change. So anytime there's a new solution that comes to someone, whatever it is, even if it sounds like the greatest thing in the world, if it works outside of maybe normal office flow, you know, because practitioners that we work with, right, they're not insurance based, they're cash based. So they're taking the time to meet with patients, which can take 30 minutes, an hour, or longer when they're meeting with these patients. So time is of the essence. So I think sometimes change in workflow is a big one, but I think working with us, there's really ways to mitigate a lot of that by programming in supplements they're already using so they can quickly select, you know, either training people in the office on how to put those things together, where the process would be very similar time wise to having them go out and building a protocol on a different distribution platform where you're selecting the protocol. It'd be very similar, right? But I do think that's one of the issues is just time. I think confusion on pricing is a big one where I always like to say it's like leasing versus buying a car. Like it's easier mentally for me to give up $200 a month or $100 a month compared to buying something all at once, even if it might be even more cost effective. So I think when you're creating a custom from scratch formula, obviously there's a manufacturing cost and it's the cost of the ingredients, but you're buying it to make it cost advantageous. You're probably buying 90 days at a time, 120 days at a time, maybe up to 180. And for the patient, just kind of seeing that, it's like, oh wow, that's really expensive. And I had a couple meetings today, and I think it's always good to ask the question like, okay, if this is expensive, expensive compared to what? Like, what are we comparing this to, right? Like, if we're comparing to buying product off the shelf at the convenience store, yeah, 100% we're going to be more expensive. Like, it's just a different world working in the physician channel with quality. But a lot of times, I've done this analysis. I did this analysis here recently with a practitioner that was doing the Bredesen protocol, which ends up being a lot of supplements. And so he's like, yeah, you know what? Like, I looked at your platform; it was too expensive. I was like, okay, like let's take time. Let's actually meet. Let's put this into the formulator and let's compare to what it costs to buy all these things separately. And when we did that, he's like, oh my gosh, you guys are actually a little bit cheaper. So I think sometimes people don't always know what they're buying monthly. It's easier for me to buy $30, 50, 40, 60, and kind of have that on a 30-day recurring payment or 60-day, and you're not really considering it. But I think just communicating to patients the cost aspect of it and kind of walking them through it, let alone the convenience and the increase in compliance and all that. I think those are probably the two main things I see. I don't know, Ben, if you have other.
Yeah. No, again, I mean, I would 100% agree with you. I think a lot of times practitioners, one, I think in a lot of meetings, a lot of them are like, hey, like, who am I to create a supplement? It's like, well, you're already prescribing these supplements that a lot of times they're taking at the same time, right? So essentially, you're already doing this. It's just making it with us is going to be, no chemical fillers, no excipients, no flow agents, none of this extra stuff. And it's actually going to be less capsules. It's going to make it easier for your patient. But at the end of the day, it's a similar process to what you're doing today. And like you said, when we really show people how to use the protocol generator, I mean, it's a game changer, right? Because just like if they were to on a checklist say, hey, I want this person to take this multivitamin, this formula for adrenal health, this formula for immunity, whatever it is, through our protocol generator, we can have that all programmed in. So they're using it like a digital script pad to build the formulas and then go in and personalize it. So to your point, yeah, I think a lot of practitioners think they don't have the time, but we can show them the systems of how, yeah, you could create personalized formulas within minutes, whether they do it or somebody in their office. But yeah, it's much easier and very similar to what they're doing today, but it's just a fresher supplement that's made for the patient that is personalized, just like the care that a lot of our practitioners are practicing.
I think you made a good point there, Ben, where I had a meeting yesterday where the practitioner was saying, well, you know what, I'm not a chemist. So how do I know
Hmm.
dosages and how do I combine these things? I think there's an uncomfortability when maybe something's being made freshly, not compared to buying off the shelf. And so I always tell them, it's like, look, most of our practitioners are not chemists. They're not, don't have extensive, very in-depth background on creating formulas. I mean, we have some, we have the Bob Millers of the world who, intelligence is about quadruple nine, right? But when it comes to this type of stuff, but no, but a lot of times how I say it is, hey, regardless, you're going to be doing diagnostic tools, right? You're going to diagnose tests, whether that's micronutrient, whether that's regular blood work, whether that's metabolomics, whatever it is, you're already going to be running tests to figure out what their needs are. And then you're probably going and you're making supplement recommendations somewhere else, right? So how about instead of just going somewhere else and recommending 5 to 10 bottles, we can just take the same protocols you're going to be doing and we can consolidate that, right? Gives you the ability to adjust the dosing if needed, but a lot of the benefit comes from just consolidation. It's not customization. You can, but the consolidation aspect, let alone, is beneficial to reduce capsule intake by 20 to 30%. You can do a powdered form if needed, right? So there's a lot of benefits, outside of that. But I do think with all the testing that's coming out, it's getting a lot more easy. It's becoming easier to make exact dosage recommendations based upon the testing.
Yeah, for sure. Yep. Yeah, exactly. And that's kind of what I was getting at is that people have said the exact thing. Like, I'm not a chemist. I'm not a scientist. Why should I be creating formulas? It's like, hey, this is very similar actually to what you're doing today. Like you said, in terms of we're just consolidating it. But yeah, I think it's good for people to know because at the end of the day, what we're all trying to achieve is we're trying to achieve the best outcomes, right? So if A, it's personalized to their needs, B, we're consolidating majority of it into one bottle, it's less the likelihood of compliance goes up, and then the health outcomes are going to go up. I mean, I don't know about you, but I hear about all the time about practitioners that talk about, yeah, the health outcomes they see going personalized, and it's not magic, right? It's fresh product personalized to them, much better likelihood of compliance. All these things combined just lead to more effective outcomes, which what we're all trying to achieve. And to your point, a lot of times they're able to get this at a less than what they would pay for something separately. So it's really truly amazing because that again, that's what we're all trying to go for here, right?
I think one thing too that's beneficial because every formula is made fresh for the patient, right? It hasn't been sitting on the shelf. It wasn't produced 6 months ago. By the time the order is placed, between 7 to 10 business days, it's out the door. It's being shipped to them. So part of that, which really comes into play, I think compliance is king, right? Higher compliance, better health outcomes in terms of actually taking the supplements daily to meet their nutritional needs. But also there's an element of freshness of product that I have seen come into play where, because I've done worked with practitioners on the compounded nutrient side where, they do stability testing, whether for a clinical trial like we've done with NASA, or we've done some other clinical trials that are pretty cool. And when you send out product for stability testing, a lot, especially I would say vitamins, probably not as much vitamins and minerals, but things that are a little, probably more natural ingredients, right? You're looking at ashwagandhas, you're looking at, different botanicals and herbals. There is a natural slight loss of efficacy over time, right? A lot of times that doesn't come into play, right? But if you get a product that was produced a year ago, right, there is a potential chance that it might have slightly less efficacy than what you're looking for the patient. So if you're dosing 100 milligrams, maybe you're getting 95 milligrams, right? Who knows what that actually, because we don't know how often companies are producing formulas. We don't know. And I'm sure a lot of physician brands are staying on top of that. But I do think there is a benefit to say, hey, this formula was made for you 2 weeks ago, hasn't been sitting on the shelf, it hasn't potentially gone through negative storing conditions or whatever it is, right? Especially on Amazon, you have no idea what you're getting from Amazon. But there is, hey, you can guarantee the freshness of this product driving better clinical outcomes. So I do think that that matters. And that's kind of, yeah, what we hear from a lot of our practitioners.
Yeah, 100%. And I think, in terms of freshness, you kind of touched on it a bit there, but beyond just making fresh product, the ingredients that we're using, like you said, they're not sitting on the shelf for a year or 2 years, right? Sure, could we save money as a company if we were buying materials in larger lots? It's like, yes, we could, but part of our commitment to freshness is not ordering a year's worth of raw material. It's like, hey, let's try to order this every quarter or maybe twice a year, right? But we definitely try to keep it fresh to ensure the fresh of the product that we're making. And I definitely think we hear a lot about those results and how that works. Um, I guess maybe to change topics a bit, but what's your take on industry trends in terms of certain companies going more direct to consumer now that were physician exclusive, selling on Amazon, and how that's affecting the practitioners that we work with?
Yeah, I think that's one of the biggest complaints I think that we're probably hearing recently, and it feels like it might come up in every single meeting. And I think there's two concerns with that. I think one, obviously, not being insurance based, being cash based, taking the time to actually meet with patients, spend an hour with them, really get to know them, get to the root cause. Any sort of revenue is helpful to further the mission, right? To keep the doors open, right? So it's not a selfish thing. Hey, I need to make money off supplements. I think sometimes people come at it from that perspective. And if they don't understand all the inner workings of an office, it would make sense that way. But, I know some of my practitioners really closely, and like some of them are, there's a lot of work that goes into this, a lot of energy. They can get burnt out. It's tiring, it's just hard to do it really, really well. And so obviously supplements are a big part of that, just to keep the doors open, to have the right people working there, to have the right type of machinery, right? If you want a red light panel or whatever it is, right? To be able to offer the best service. And so obviously if patients are now able to go other places to get product that you're selling, whether that's on an online distribution platform or if it's on Amazon, right? Like that's taking away revenue from the clinic that could potentially hurt the mission that practitioners are out to, to that what they're passionate about is really helping patients. And so, exclusivity is crucial where, hey, if I recommend this product to a patient, and to be able to get the revenue off that for the time they put in there to keep the doors open, I think it's really important. So I think that's a big issue right now is now a lot of physician brands that, for the longest time were saying they were going to be physician exclusive are now not physician exclusive, and they're selling through different ways. Like I could easily go to Amazon or I can go and just Google a product. I could find someone selling it, some online platform selling it. I could buy it cheaper, get quicker shipping, whatever it is. That's really harmful to our practitioners from like a monetary revenue standpoint, but also just the quality. Once people leave the confinements of where you're making supplement recommendations, things get weird very quickly, and there's a lot of loopholes that can take place on just the quality of product that someone can be getting. And I know there's been some issues recently with Amazon where, it used to say, hey, if you buy directly from the company, their store, you're going to get the product from them. Where I think some of that might be changing, where they're potentially all products is just being put into a bin and you're just kind of getting whatever is in that bin, right? Whether it's counterfeit or regular. And maybe that's changed, or maybe I'm saying that wrong, but I do think there's a lot of counterfeit product out there. There's a lot of product that's stored in improper conditions, which affects efficacy of product, oxidation. So I think it's twofold. I think it's really hurting our practitioners from a revenue profit standpoint, right? Just to be able to do the type of medicine they want to do without insurance. But then also it's bringing in quality questions on what the patient's actually getting. And we always kind of joke the most expensive supplement's the one that doesn't work. So if they go out and they're spending $20, or even if they go to another site and they're you recommended, hey, this product from this company, and they see another product with similar names, similar ingredients, oh, I'm going to buy that one. It's $10 cheaper, but it's not efficacious. It just kind of opens up that door for a lot of discernment decisions made by the patient that might not always be in their best interest. So yeah, I think those are probably the two biggest things that are really hurting clinics. And you can kind of hear it all the time, right? Hey, supplements are a big part of our practice. Is how we serve our patients and do what we do, but it's hurting a lot of clinics right now, and it's unfortunate. So, yeah, I don't know
Yeah.
what kind of stories you're hearing that a lot, Ben, but I'm definitely hearing it.
Yeah, yeah, no, I mean, it's definitely a topic that comes up. It's a lot of times it's a topic of frustration because yeah, they spend a lot of time educating their patients on why they should be taking, these supplements from these companies, but now they could exactly find it online for cheaper, faster shipping, all of that. And so, yeah, in the day and age where every practitioner has a full script and, all of these supplements are so widely, not all of them, but a lot of them are so widely available, on Amazon and potentially directly from the websites, yeah, it becomes problematic to the practitioners. And I think we've had a lot of people voice to us their concerns of, yeah, kind of how they've been affected with that. And I think you mentioned it, right? Exclusivity. We've had a lot of practitioners kind of current clients, but a lot of new clients reach out to us because yeah, they want to create something exclusive, right? They see what works, right? They have a clinical opinion on what they want in their particular formulations. And it's awesome to be a part of it is when we're able to consult with these practitioners, help them create a consolidated protocol, and then just hear about the amazing results they get. Because again, right, we're trying to achieve optimal health outcomes, and so it's great when they have a product that's working better than what they had before. It's less bottles, it's less capsules, it's a better price point. Then they're able to kind of help more people. And again, from a there's nothing wrong with it being happen to be good for business too. All of those things. So it's sort of a win-win-win for everybody, right? The patient, the practice, in terms of them having a formula that their doctor formulated for them that's fresh. Again, all of the above in terms of less capsules, less bottles, all of that.
Yeah, I think speaking to the exclusivity part, I mean, we hear in clinics, even just private labeling a product leads to like 50% higher reorder rates. Like it really increases reorder rate retention. So private labeling any product, having exclusivity is really beneficial. I do think there's benefit of having a product that's not out on the market. Like if you're able to optimize and have something that's unique to you, in manageable quantities, like the compounded nutrients, you go order 24 bottles of a stress formula. You can optimize it, have some different dosages in there, add another ingredient with some cool research behind it. And then that's something they can't go get that anywhere else. Right. Because sometimes I hear stories where patients even look for stuff like they're just, whether it's distrusting or whatever, they'll search for the ingredients in the dosing, even though your product's private labeled, they can find the product by just searching for the ingredients and then they can buy that product. Right. So if you have something exclusive, they can't do that. But also, with personalized nutrients, obviously the private labeling part is great, but a lot of times you have to buy products, whether store it, use some 3PL distribution company to store it and ship it to patients. A lot of people don't do, or maybe they don't want to have the capital outlay to buy 24 bottles, 36 bottles of whatever it is in private labeling, because that's money that's sitting on the shelf and it's not being able to be used. And so the benefit of personalized nutrients is one, you can't go anywhere else to get your personalized formula. You can't go to Amazon and say, hey, Michael Loomis supplement formula based upon my genetics and metabolomics. Like you just can't go find that. So there's a benefit in and of itself, so that's huge, but also, there's no capital outlay. So whenever there's ever transactions, that individual formula, you're not buying formula and stocking, it's just made as needed, right? So we see 90 to 94% reorder rates on those because it's like truly exclusive to the practice with their name on it, right? So yeah, I do think the exclusivity is huge for clinics regardless of how you do it. But I do think having some more exclusivity in terms of different formulas and optimizing is also crucial.
Yeah, for sure. What would you say, some hot topics in terms of kind of conditions, like formulas that you've been formulating lately with practitioners are?
Yeah, I know we just talked about one. I was going to ask you about it actually, but I think right now the hot topic is just longevity. I think longevity is huge. I mean, there's always the normal ones, right? The multis, the D3K2s, the immune, the sleep, the stress, all that type of thing. Like that's always going to be there. But I think currently with a lot of the research coming out with longevity, right? So we're doing a ton of longevity formulas. Like we brought on urolithin A, which is a metabolite produced by the gut, usually in consumption of pomegranate that I forget the exact percentage, but it's less than half of the population can actually take this and convert it into urolithin A, and you have to drink like 8 cups of pomegranate juice. It just doesn't make a ton of sense. But urolithin A induces mitophagy, right? So the recycling of mitochondria, which is, I mean, healthy mitochondria. If your mitochondria are working well, like you're probably staying healthy for the most part because that's going to buffer so many things. So a ton of longevity formulas with things like urolithin A. We just brought on spermidine, a gluten-free spermidine that's very cost effective, which promotes autophagy. So think about a formula with spermidine for or urolithin A for mitophagy, spermidine for autophagy. You're getting cellular renewal every single day in one capsule. It's pretty significant. Nicotinamide riboside chloride boosting NAD production, which I think there's a lot of confusion around oral supplementation for boosting NAD because taking NAD orally, from what I've seen, isn't that efficient. It has to be converted and it doesn't necessarily always lead to boosted NAD. But nicotinamide riboside orally, not talking about IV or things like that, is the best precursor to boosting NAD, right? So a lot of things like that, CoQ10. So yeah, I would say we're doing a ton of longevity formulas, cellular health formulas, and there's so many ways you can go with that, right? And cell membrane integrity with phosphatidylcholine or whatever it is. But it's kind of fun to take because a lot of times when you're doing these longevity protocols, you're having to recommend multiple different bottles. There's not a lot out there that has all these different things in it. So it's kind of cool to, put on your quote unquote chemist hat, right? And kind of combine some of these things and just think, oh, wow, if I take this, this is all the benefits I'm getting daily. So I know I'm doing a lot of longevity, but I don't know what you're seeing.
Yeah, yeah. I would again agree with you. I know we're talking to a lot of practitioners that are doing the same thing. So longevity is something that's a topic, and if we didn't discuss it, it's always good to bring it up. Because I'm seeing it a lot out there in terms of NAD, right? NAD IVs, and I mean, I think I see a lot of stuff on social media of that Kardashian clip where they're talking about how they're getting the NAD IVs, and people are
Yeah.
sort of like marketing that, right? But yeah, at the end of the day, as we age, right, our NAD levels decline. So it's like if we could take a supplement to help increase that and help with better cellular health, help with so many different functions in terms of metabolism, cognition, a lot of these different things, right? Mitochondrial health. Why wouldn't we do that, right? Because studies show, 300 milligrams a day after 4 weeks, it's like NAD production is up 56. If you want to take a gram, it's up like 142%. So really incredible. Like you said, it's the best NAD precursor. NMN is pretty decent too, right? Although it's technically in a gray area right now with the FDA. Hopefully it comes back and we can carry it again. And then, like you said, in terms of NAD itself is actually sure, if you wanna go get an NAD IV, great. It's good for you, but if you're gonna take it orally, it's not well converted. So, yeah, the best NAD precursor definitely is nicotinamide riboside chloride. So we've been doing a ton of formulas with that. Spermidine, like you said, is super cool in terms of its ability to induce autophagy. It's been shown to help with gray hair, which is cool. Again, help with cognition, inflammation, all of these different things. So, we have the pterostilbene. Trying to think of some other things. We have the fisetin, a lot
Yeah.
a lot of
Quercetin and fisetin work senolytic properties, right?
yeah, yeah. So, and
Well, you're
then,
doing some cognition, right? Like you're doing some cognition blends.
yeah, yeah, I've been doing a lot of cognition stuff. So, our favorite ingredient, Cognitique, right? Coffee fruit extract, 100 milligrams a day increases brain-derived neurotrophic factor by 143%, which is pretty crazy, considering that caffeine in coffee, only increases brain-derived neurotrophic factor by 40%. And there were some other things they compared it against, but it's a pretty large increase. And in terms of its effect on people's overall cognitive performance, I think after a week, it increased by over 20%. After a month, it was like close to 30%. So a really good base for a protocol, right? Whatever way you want to take it. If you wanted to include some other botanicals like ginkgo biloba or bacopa, or maybe something like vinpocetine to help with your brain circulation, maybe some lion's mane, phosphatidylserine. I mean, the limits are endless. But yeah, we've been doing a ton of stuff with that, and it's been interesting too because a lot of times, we could sell it, we could say the research and everything, but a lot of times I've just been given practitioners a sample bottle to either try themselves or have somebody else in their office try, and they've been impressed with just the effects of just the Cognitique, let alone, not including whatever else we would throw into the formula. So yeah, cognition has been big. And for me personally, it was something I kind of shied away from for a little bit. A lot of people would be interested in cognition, and I just never felt like, I mean, we had a lot of good ingredients, but yeah, but Cognitique is really a great affordable base to build around. So definitely been a point of comfort lately.
I think the thing that really works in our clinic, and I think the clinics we see, really have the most success with some of these formulas is you want them, obviously, a lot of ingredients work at a cellular level. You might not feel things right away, right? And and the practitioners know, okay, look, I know this is working. We're going to recheck levels. You'll probably feel good and start to feel better as time goes on, depending upon what their deficiencies are. But I think it's really important to have them feel good right away, so they buy in, right? Have patient buy in early on. So things like Cognitique, like there's a lot of things that with cognition formulas, like everyone would like to have faster processing speed, better energy, better brain function, right? Like I think in today's society, just stressed out, tired, rushed around, like that's just so key. Everyone wants that. And so, when you're doing a cognition formula, maybe you're throwing some things in that might not be as noticed right away, but throwing in something like Cognitique, that's something people feel like right away. Whenever I hear stories about it, whether someone's sleep deprived or I just give it to them at a convention, or like Ben says, you send them samples, like they do notice something right away. And I think that's kind of the cool part about creating some custom formulas is you can take things that might be working more long term and affecting things in different ways just for overall cognition support or whatever it is long term, but then to have something else in there that you can throw in there as a caveat for the patient for them to feel good right away so that they buy in, they feel the difference of the product, they're going to keep taking it, then it's going to work on other cellular pathways. So that's kind of the cool part about things like Cognitique is yeah, that quick, hey, I want to feel good, right? And just kind of optimize some stuff just to get that type of effect quicker.
Just trying to think of some other ingredients, maybe ingredient highlights that we want to talk about while we're doing this.
I know you're big on Careflow Mango.
Careflow mango, yeah, I love it. That's another ingredient, another great ingredient, right? It's like a mango extract. But what's cool about that is it helps increase microcirculation, nitric oxide production, but all at just like 100 milligrams a day. So again, it's not going to add a lot of cost, but great for a lot of different formulas you could put it in, right? Whether it's a cardiovascular health formula, whether you're trying to do something for nitric oxide production or like erectile dysfunction, um, or even, if we're talking about cognition, again, if we're increasing the microcirculation, it's going to affect the brain as well. But yeah, I know it works on the SIRT1 pathway, so endothelial health, right? You could even throw in an anti-aging formula. So it's another very versatile ingredient that you could really, I mean, you could even throw it in a multi, right? And it's not going to change, it's not going to affect the cost that much. But again, like a lot of people, as long as they're not allergic to mangoes, a lot of people could benefit from, yeah, just a little bit of that Careful mango a day in terms of their cardiovascular health and other things. What about S-acetylglutathione? What's your take on that?
Yeah, I mean, personally, I worked on a formula that we added it to it. I haven't dove too deeply into the research, but I do know like what we previously had was a reduced form of glutathione, which there's always debates on every ingredient. We joke if you got 100 doctors in a room, 50 will say one thing, 50 will say another, and they have research to back it up, right? So, this obviously with a grain of salt, but from what it seems, the reduced glutathione isn't as absorbed, right? So you have to dose higher to get glutathione benefits, right, within the body, antioxidant properties, all that. So we actually just brought on S-acetylglutathione, which, again, I haven't dove into the research to know all the science behind it, but it is way better absorbed compared to the reduced form. So, so we do powders and capsules, right? So it's nice when we have ingredients in the powdered form, like an S-acetylglutathione that is more bioavailable, right? That can be added to a formula to get that benefits with a lower dose, right? And so we brought that on, and I think that's one thing a lot of people are using, obviously, for glutathione, the master antioxidant is super important, right? And with a lot of people that are chronically ill, dealing with issues with their age, whatever it is, like they're needing glutathione for whatever protocol they're doing. So to have something that's more bioavailable to be taken added to formulas is pretty crucial. So we're excited that we brought that on.
Yeah, yeah, I'm super excited to have it on. It's been a topic of discussion in meetings that I've been having because, like you said, the reduced glutathione that we carry is a great form of glutathione. It does increase glutathione levels, so it's great. But obviously, the S-acetylglutathione is just a better form of glutathione. It's going to be a bit more expensive, but to your point, you could dose it less and have similar outcomes. I want to say the recommended dose is 100 milligrams twice a day, but the studies have been pretty incredible. I think there's even research out there showing that the acetylglutathione at that dose competes with the absorption that people get with glutathione IVs, which is pretty insane.
Yeah, you don't
So
have to dose that much. Yeah, it's 100 to 200 milligrams is what
yeah,
you're gonna see.
yeah, and super well absorbed. A lot of times when people talk about glutathione, right, they talk about like liposomal glutathione, and so there's comparisons. Comparing the liposomal versus the acetyl. But actually, the S-acetylglutathione wins out in terms of its ability to increase the intracellular glutathione levels. So pretty awesome. Really excited to have it because I know, yeah, a lot of practitioners will be interested in using it, whether it's standalone or yeah, combining it in formulas. So yeah, that's a great ingredient. Um, anything else you wanted to chat about today?
No, I mean, I think that's good. Yeah, I think, and obviously, we have a lot of ingredients, over 350, so it's hard to cover, and I'm sure we'll get into more in the future. But yeah, we're always constantly adding, which is fun based upon the research that's coming out, what our practitioners are asking for. That's what drives us bringing on ingredients. So yeah, there's a lot of cool stuff that's happening and coming on. So it's fun. Yeah, it's fun to talk about.
Awesome. Well, appreciate your time, Michael. I know we'll be doing a lot more of this.